Well, good afternoon. Welcome to this special Newhouse School Zoom event in which we talk with important public figures who are going to share their views with Newhouse students, alumni, and friends. I'm David Rubin. David Rubin, for those of you who don't know me, I'm the former dean of the school. I'm now retired in South Carolina, which is one of the hot spots in the United States in the COVID-19 pandemic. And I mention that because it brings us to our guest today. She is joining us at a very significant moment during this public health crisis. She is Rebekah Jones, and as billed, she is our whistleblower in Florida. Rebekah graduated from Newhouse in 2012 and was a dual with the Maxwell School in geography. More important, she was in my Com 107 class in her first semester at the Newhouse School. And I knew immediately that she had guts, and even then, a very strong social conscience. About a month ago, she challenged the administration of Florida Governor Ron DeSantis on the accuracy of the COVID-19 data that he was providing to the public. And she paid for her honesty with her job. Part of her story has been told in the Washington Post, on CNN, and there's a lot more media attention to come. But now she is here with us to discuss this story for the next hour. Hi, Rebekah. Nice to see you.
Hi. Hi, everyone. How are you? How are you, Dean Rubin?
You don't look a whole lot different from that freshman year.
I'll take that as a compliment.
You're aging well. A lot better than I am.
Oh, and you also forgot again that I was also in your communications law class my last semester at Newhouse.
All right, so you had a double dose.
Yeah, first semester and the last one.
Well, no wonder you're having such a great career. How about that? All right, let's get to it. Let's start with this. How and when did you get the job with the state of Florida? And what task did the state of Florida want you to undertake for its citizens?
Okay. So I had been the geospatial science and systems manager at the Florida Department of Health for a while before this even happened. I actually started there in September of 2018 after I finished my PhD courses at Florida State. And in January, I actually started asking DOH if I could build this dashboard, envisioning something slightly different, but along the same general lines. And I was told no for almost 2 months until I finally got the green light. And they said, okay, here's the data. Don't reveal anybody's identity. And this is what we've been releasing in this table of things, and, you know, do it. And so I had a lot of creative freedom and freedom in a lot of ways with data management in the beginning. And so I worked on that for 2 months straight, 16 hours a day, managing it, managing the data portal, communicating with every single person who ever emailed me, no matter how obvious the answer to the question was or how angry the writer was. And that was my job.
And did they think was it their expectation that you were building this dashboard that citizens of Florida would regularly look at in order to determine the spread and severity of the virus?
Yes, it was our public face of all the information that we had about coronavirus when it first started, which at that point in early March wasn't a whole lot of information. The epidemiology office had just gotten started. They were, just beginning contact tracing for a lot of this. So a lot of the data was blank, but it was the frame of what it would eventually evolve into the dashboard that they have now, and was supposed to be our single point source of information for the public to get data and information about what was going on in Florida.
So you were filling a void. There was no way until you and your dashboard came along for Florida citizens to be able to follow the spread of the virus?
For about 2 weeks before I made the dashboard, there was a table list of people who had been confirmed positive that for some reason auto cut off at 100. And it was like an Excel spreadsheet looking thing, but you couldn't download it. And that was the only other source until the dashboard. They didn't even actually finish building the website for our response until a couple weeks after I had the dashboard live.
Wow. All right. What skills did you have that made it possible for you to build this dashboard?
Well, one of the skills was something that I loathed taking classes for while at Newhouse, which was design. As a journalism major, I had to take graphics, 217/218. And I struggled through that entire course. My professor at the time is now at Ole Miss. And I still credit him 100% for me having any eye for design whatsoever, because I was never good at that. And yeah, so all my information about how to lay things out, what color schemes to use, what kind of, things to avoid, that was all Newhouse. My journalism degree helped me immensely in figuring out, okay, if I was just a member of the public, what information would I most care about? And what is the simplest and most accessible way to deliver that information to people? Having a communications background was, a huge part of how I was able to do this. Now, all the coding and the geographic analysis parts of that, obviously that was more Maxwell, but all of the aspects that made me a good communicator were Newhouse.
Oh, well, that is great to hear. Now, explain to me where you got the raw data about the spread of the virus to plug into the dashboard. Where did it come from?
So the Department of Health manages all of its raw case data in a system called Merlin, which is a disease database system. So basically every time a person tests positive for the first time, a case is auto-created in that system. And I pulled the raw data from that system and then aggregated it to the county level, so I could say how many cases were in each county, how many people we tested, who were Black, white, Hispanic, what the rate of death was for that day. And so I actually was working with the raw data that had people's names, their social security numbers, their addresses, and really kind of scrubbing that down into something that could be consumable by the public without compromising the privacy of any of the people that were testing positive.
How confident were you about the accuracy of that raw data? Because the aphorism, garbage in, garbage out. So if the data isn't accurate, then the dashboard wouldn't have been accurate. So what did you think?
So there were a lot of things that we, had faith in. And I worked very closely with the epidemiologists at DOH. It was a different office that I was in, but, we kind of merged for the time being. And how many cases we had was never an issue. These are the people who have tested positive. That's easy. Like positive result, boom, you're in. Some of the other data was not collected consistently. And as we had a lot of mobile kind of testing stations setting up, they weren't getting all of the demographic information, for example, about the people who were driving through and testing. They didn't fill out, whether or not they identified as white or Black, other, which having only those three races was a problem in and of itself. But that kind of information was never really dependable. When we first were forced to publish it, some of the epidemiologists who have since left did not feel comfortable with it because about half of the cases that we had didn't have that information available. And you can't really use the information we did have to make any meaningful observations about trends if half the data was blank, because you have no idea what the rest of that information was comprised of. But other than that, while I was there, I didn't feel like there was a strong chokehold on what information was coming to me. That has since changed. Several very important people at DOH have also left, I found out recently. And so now I don't know.
All right, well, we'll get to that mess in a second. How popular when you were there was the dashboard? Was the public using it a lot? What'd you hear?
Yeah, I had made dashboards or, similar things in the past for hurricanes, which is really what I worked on a lot while at DOH. And, you get a couple thousand views. I was just elated that, a story map I made about Hurricane Michael was, a couple thousand views. And when I envisioned this, I didn't, I think, anticipate, I don't think anybody could, that it would be as widely successful and as widely viewed as it was. As soon as the governor announced it, 3 days after I made it, I had to go in and change a ton of settings to make sure that we didn't crash our servers. And by April 26th, which was, I think, 5 weeks after it launched, we hit 100 million views.
100 million views.
100 million. Yep. And that was in April.
So presumably you would have had even a lot more now, given what's happening in Florida.
I haven't tracked their usage much since then, but I kind of feel like I should, because I'm competing with my own old dashboard now, like my new dashboard and my old dashboard. I kind of want to see how they're doing side by side. But yeah, I imagine that it's gone up quite a bit.
So in the early days, was the DeSantis administration happy with this dashboard and what you had built?
I wouldn't know. They never spoke to me or got involved with it. This was really something that in the beginning was housed in epidemiology. And our concern was at that point making sure that the data was being processed properly and that it was getting up when it was supposed to be.
So even though you were the kind of public face to the citizens of Florida about this crisis, you at that point, you weren't hearing anything from the governor's office, the guy who's supposed to be managing this crisis?
Nope, he never got involved. I had worked with Scott Rifkes, who's the Surgeon General for Florida, in the past. Actually, last year when we did our week-long hurricane exercise and we all stay crammed in a tiny room with a long table that doesn't even really fit, we were stuck next to each other the whole week and I had no idea who he was. And so I was being kind of my regular foul self. And then somebody's like, that's the Surgeon General. And I was like, oh my God. I was like, whoops, I had no idea. He's a normal guy. He probably knew much more about what was going on. He actually did an interview for the Syracuse University News about the dashboard before I ended up leaving it. So he's quoted in that as well. But any higher than that, that information would have never gotten to me. I was not important. I was not the face. I was behind the face. I was the face behind the face. So yeah.
All right. So at what point did you find out that there were some problems, that the DeSantis administration wasn't happy? What kicked that off?
Well, there were a lot of warning signs early on, I would say, little micro, control things. As cases really started to increase, they decided that they wanted to review the data, the final output before it was published. And occasionally that led to deleting a few deaths or cases until further investigation. But it wasn't anything that I felt was overwhelming. It was normally fixed the same day if they had a problem, but that they wanted to personally review data that they didn't understand and had never seen was a little strange. When I first got involved in early March before the dashboard was built, I was actually tasked by the Department of Emergency Management to find all of the polling precincts, voting precincts in the state that were in what we called high-risk community places. So Florida, for some reason, has a lot of voting precincts that are inside nursing homes and other facilities that are similar to that, because the state wanted to move them quickly. This was about 10 days before the election, so that those places were not being exposed unnecessarily. I had alternative sites set up for almost every single facility that was in a nursing home. I had the list so that counties could scout out other community centers that met the requirements to serve as a precinct and wouldn't have to go one by one and by themselves and look for them. I just had a list I was able to print out through my analysis that says, here are the other facilities that meet these criteria for voting precincts instead of this one in this polling zone. And the governor's office intervened and decided not to do that, which was very strange to me because we had it ready to go, and they decided not to do that. And we kept a lot of those voting precincts in those facilities. And I'm positive that that led to a lot of unnecessary cases and deaths that may not have even been tracked, because back in March, we had very strict requirement for who was being tested and who wasn't. that was kind of the first thing that kind of bothered me a little bit. But it continued on, little things here and there about how we displayed this, whether or not we showed that. But the real thing that bothered me was at the end of April when we were coming up with our reopening plan. And it was supposedly going to be this science-based initiative that used our case data, our surveillance data of ERs and hospitals, and made sure that we were following what the data said and the science said before we took any action on reopening. And I was asked specifically by leadership, this kind of mythical office that I knew some of the people were involved with, but not sure who all. I wasn't important enough to be in that conversation, but asked me to do the analysis to see which counties, based on a set of criteria that our epidemiologists had identified, were able to reopen. And when I went to show the plan to DOH leadership, and they were printing and stapling the plan that was already written right in front of me as I was presenting the results of that analysis for the first time. So that was my first sign that the data and the science didn't really matter, because the plan was written before I even presented it. And when I did present it, they were expectedly disappointed because it didn't match the plan. So they started changing the criteria. They moved the goalposts. They exempted rural counties completely from the entire criteria, which to me made no sense. I don't know why you would have a statewide criteria to say it's safe to open and only apply it to, a third or a half of the counties. And even when, after massaging this and recalculating that, it didn't match what they wanted, they asked me to go into the raw data, and let's say for testing, it couldn't be above 10% positive. Your testing ratio had to be below 10%. And if it was 18 or 20, she said, well, just change it to 10. Just change it to 10. Then they'll meet it, and then they can open, because that's the only thing that's keeping them from being reopened. And I said no. And I held firm on that one. And the next day they hired a vendor to do the calculation instead, who magically came up with the exact results that the pre-written plan had laid out. And a week later, I was taken off the dashboard.
All right. I want to back up before returning to that, to the business about the polling precincts, because I've been following this pretty closely. I've never heard about this, and it strikes me as newsworthy.
I've mentioned it before. I kind of have this attitude that things that happened in, January, February, March, which I've, given a lot of people documentation about in the press, aren't as important to me as the things that are happening right now. So I try not to spend too much time talking about what happened in January and February, March, because I'm more concerned about what the data is showing now and how that might influence people's behavior. But yeah, I have mentioned that a few times, but I don't think that it's really gone anywhere.
But these Rebekah, must have been primary voters in a primary.
Yes.
Who were being sent to polling places where they then could have spread the disease to older people who were at risk. Is that what was going on?
Yes. Florida has a lot of polling stations, and this was during the primary. So I don't think the Republicans had a primary on that date. This was in early mid-March. And so this would have been largely Democratic voters that were going to vote in primaries. And the polling stations were at nursing homes. And I was asked by DEM to come up with a list of places to move them to, but it didn't happen. They never did it. Some of the counties decided to move some of them themselves because they weren't getting any help from the state, but there were too many polling stations for counties to individually have to go and find an alternative site. We could have given them a week to do it, to advertise it. It had been moved, to put up signs or print signs that say, hey, this polling station's been moved to, 2 blocks down the street, and advertised it well, but they didn't pull the trigger in time. And so they decided that they were just going to keep it and let the counties move it as they wanted.
Well, this alarms me. Does this alarm you?
Oh, I was extremely pissed off about it. I sent a lot of angry emails to my superiors, like, we have time to, I actually said, I was like, we have time to do this. I was like, I've done this, it's already done. All we have to do is, like finish it and send it off to the counties, and they don't have to do a, station by station analysis. We've already done it. We've already identified all of the public facilities in a, geographic distance that they could use as alternative sites. And they decided that they didn't need it and they didn't want it, and they weren't going to do it. I wasn't a part of the conversations as to why that happened. After I came up with the list, I was actually completely shut out until the dashboard, needed to be built for about a week. So I did submit an actual official complaint back then when it happened, because I thought that it was going to cost, unnecessary lives. But DOH seems to lose those complaints quite a bit. I still have the emails though, so.
All right, then on the reopening, this must have been at the time when Governor DeSantis wanted to open up Florida, and he was criticized that perhaps he was going to be opening up too early. What was it, again, in your data that would have led him to slow down that he was unhappy to see?
Well, the original plan was to start phased reopening kind of county by county basis. So each county had to individually meet this criteria. And he ended up forcing about 20, I think it was 24, 25 counties into the first phase of reopening who were not meeting that criteria. So it was very much, I think it was more of a desire not to be seen as giving more populated counties the permission to reopen while more rural ones were not. I think that partly because one of the communications people flat out said to me, well, we can't tell, Palm Beach or Miami-Dade that they can reopen, but, Franklin County can't. It'd be a political nightmare. Part of DeSantis's, actually most of DeSantis's base is in the lower populated counties. So restricting them from reopening and allowing more populated places to open would have looked bad, I guess. I don't know. I don't understand the reasoning behind that. But there were dozens that were able to reopen that were not ready. And they immediately saw spikes.
What did you know about those counties that shouldn't have reopened, that did reopen anyway? What was the problem in those counties?
It really varied. One of them was that there wasn't enough testing going on in those counties to be able to assess how much of the virus was there in the first place. Actually, the director of disease control sent me a message saying we're not doing enough testing in those counties, so we might just have to exempt them from that if that's what the state wants to do. Which was one of those things, again, I said, well, what's the point of having a criteria if you exempt everybody from it? But that was a big part of it, is that the testing was very limited. We didn't have enough information about what was going on in those counties to be able to reopen. Some of the surveillance hospital data, so we basically tracked ER visits by the codes that the doctors would enter about what their symptoms were, and made sure that like ER visits were being added, and see how many people with influenza-like illnesses or pneumonia before they're tested are going on in the hospitals. And a lot of that data said that those symptoms were increasing, which is a precursor to cases increasing. So that was another big problem. And even stranger on top of that, some of the counties didn't have any ER data at all because they didn't have hospitals. There are a lot of extremely rural counties that right now don't even have ICU beds or isolation beds available. So that information was also very limited. It was really just not enough surveillance going on in those counties. And the little bit that we did have was keeping them from meeting that criteria.
And your suspicion that the early opening of these counties would lead to spikes in virus was borne out?
I think anybody who's seen the last week or so of data would know that, unfortunately.
Okay. So now this famous meeting where you went with your data and you found that they'd already written their plan and they were stapling it and putting it together. What was your response? What did you do next? What did you say?
So after I said no to changing the actual data itself, that's when they decided to just exempt rural counties, and then they packed up their stuff and they left. And I kept continuing to work on it and trying to find a more statistically sound way of approaching one of the problems that they had that I thought we could pay more attention to is that, let's say for rural counties, if you have one increase in cases, then you are disqualified because that's not decreasing over 2 weeks. And I suggested some more robust statistical approaches to saying, okay, well, we know this is a small numbers problem essentially. And one increase by one case increase this week versus, 2 last week isn't really indicative of a trend. It's something that would be considered more stable or marginal and shouldn't exclude a county from being able to reopen. And that's true of Miami-Dade. If they had 500 cases last week and 501 this week, that's technically an increase. This is kind of this binary yes or no, it meets this criteria, but it's not indicative of an increasing trend. It's stable. And so I was working on that, hoping that they would adopt that approach instead of just exempting everybody so that we could see which rural counties were actually having trends of increasing versus ones that just didn't have that many people being tested. And, one being positive every other week is not really a trend. I worked on that for a few hours. And then when I sent it in, they basically said, no, we don't want to go this direction. And I drove home that night, and I remember looking over what the plan said and what the data was saying, because once I had the actual statistical analysis, it was not good. And I actually texted my mom and my sisters, and I said I wanted to quit. I said I'm being asked to do things that are wrong in support of this plan that I don't know if it's right or not, but it's, because there are legitimate social and economic reasons to maybe start reopening that the data doesn't support. And it would be fine if you said that, but changing the data to make it look that way is not something I was comfortable with. And I said, more people are going to die because of this, and I don't want to be a part of it. The next day, I actually emailed several people that I know about possibly finding jobs somewhere else. I was interviewing right when I got taken off the dashboard because I wanted to leave. And I basically had this idea of they can do whatever they want. I am not going to be a part of telling people that it's safe based on science to do these activities if that's not what the science actually says. I'm not going to be a part of that. I wasn't planning on going public with anything or being a part of a news story. I was just going to leave, get a different job. And then I was taken off the dashboard because I wouldn't delete data, just outright delete it from what we were publishing. And I was back to just my regular job as manager of GIS. And when a story broke out by Florida Today that I had no idea was being written, I didn't hear anything about it. I didn't interview for it. I'd never even heard of the person who wrote it. They fired me.
This appeared in a newspaper, Florida Today?
Yes, this was in Florida Today, which is, I think, an affiliate of USA Today. Since then, actually, the reporter who broke it, I did find out he did send me an email at like 8 a.m. that day. But I was packing because I was supposed to be on vacation that week. It was kind of my response to being taken off my dashboard and then being asked to fix it every day for a week. I said, okay, hurricane season starts in 2 weeks. I'm taking a week off. I'm going to spend time with my family. I'm going to see my parents that I haven't seen, in months. My mom and dad lost their house and everything in it during the tornadoes in Easter. And I didn't go help. I stayed at DOH to do my job. And I wanted to spend some time with them. So I was going to be on break. And so I wasn't checking my email, and I didn't see the email he got asking me for a quote. And I found out that the article had been published when my phone wouldn't stop ringing because people were asking me if I had anything to say about this article. And then I got fired after that.
Do you know to this day how Florida Today got the story? Was it from a friend of yours who leaked it to them?
So I was taken off the dashboard on, I think it was May 5th or 6th. It was the day that we reopened. The first phase 1 of reopening was when I was taken off for not deleting data the previous night. And after that, it had not worked properly. It had been down almost every day. They called me every day to fix it for 4 days straight, even though I kind of had the attitude of, you know what, if the governor's office wants to control it, then they can control it. They shouldn't be coming to me for help. But because I had spent so much time building this thing and taking care of it, it was actually, and I was looking for jobs. And this was kind of my, like, top of my resume. I didn't want it to, not work, but people noticed that data was changing, that there were problems with the data feeds that I had maintained, that the data was suddenly inconsistent. The total case counts for county actually decreased over days. So I was getting a lot of emails from people I had worked with for months, mostly county officials who were using the data for planning, city officials like the mayor of Gainesville and things like that, who really needed the more local data that I provided to say, okay, well, this is where we want to set up testing centers and things like that. And I was getting constantly flooded with these emails. And so I finally said, okay, I sent an email to the data users group, which was mostly technical people. And I said, I'm not running the dashboard anymore. I can't help you. I can't answer your questions. These are the people that are in charge of it. I would be careful because I know things are changing and I wouldn't expect them to kind of maintain my philosophy of data transparency and accessibility the way that I have. And so I sent that memo to them. And it leaked. And so that is the story that came out, was this memo, which was really me just trying to say, look, I can't help you. I'm not the person to ask it. I can't fix it. I'm not allowed to touch it. And you should ask these people about it instead. And my little comment about I wouldn't expect the transparency and accessibility, somebody called it a flaming arrow. Which it was not exactly what I intended. And I was being truthful. It's neither transparent nor accessible anymore. But yeah, that's kind of what fueled the story.
And I assume you did not intend that flaming arrow memo to leak?
No, I got a call about an hour after I sent it from a reporter at the Miami Herald, asking me what I meant and why I was taken off the dashboard. And I was like, I probably sounded like a stupid idiot. I was like, I don't know if I'm allowed to talk about this. Bye. And I hung up. And so I thought, okay, that's the end of it. No, it wasn't. Incidentally, that afternoon, I actually spoke to my boss about filing a whistleblower complaint about the way that the case data was being handled, the way that I was taken off the dashboard, specific people in the office who were doing things that were unethical. And he advised me not to do that. And this was at the end of the day. And he said, but if you decide that you want to, here's who you contact. And the next week I was off, so I didn't get the chance to even formally file that complaint before I was fired.
Okay, so I gather the reason for the firing from the government side, from the DeSantis side, was the memo leaking to the press, and then it looked like they were manipulating the data. Is that right?
That was the implication of the article, although I had never said that. And
they were in fact manipulating the data.
They were, but I didn't specifically say, hey, they're lying about this. I just kind of said, be careful when you're using this data because it's changing and it doesn't necessarily represent the same thing that it used to. And if you're using this for things like targeted nursing units, you should be aware of this kind of thing. And I'm finding out more recently through public records requests that a question to my boss about filing a whistleblower complaint might have also played into my termination as well, because I was fired the next day.
And overall, would you say that the administration was making the crisis look less serious, aggressive, or progressive than it was? Was that their goal?
Yes, that was their goal during several periods. I've checked out the data that's been produced over the last month since I started back on this kind of track. And I've verified it with multiple journalists who are data analysts as well, that they've been deleting cases at first 10 or 12 a day. And then it kind of started increasing dramatically. Their official word is that they were reassigned to another county, but that there's not an influx of cases to other counties that accounts for both the new tests and positives and the ones that they moved. So we don't know why they're deleting all these cases. That is a major concern. And It's also worth noting that the head of epidemiology at DOH quit on June 11th, which is the day that DeSantis announced that K through 12 schools will be fully reopened in August. So about a month and a half from now. He quit the day that that was announced. And there was an article in the Miami Herald that quoted a former DOH employee who I'm pretty sure I have an idea who it was, that he quit because he didn't want to be the scapegoat for when lots and lots of people got sick and died from how DeSantis is managing this. So I think the official word from DOH was that he was exploring other career opportunities or something like that. What he actually did was get up and leave the state. He went on a cross-country trip immediately after he quit, probably because, you know, I had reporters camped outside my house for a week after I got fired, and he didn't want to have to deal with that. But I'm actually, even though we had very different philosophies on the public's right to know and the relationship of science with journalism, I'm proud of him. We didn't get along very well, but I think that in the end, when he heard DeSantis's plan to open K through 12 schools, you know, he's got kids, he couldn't live with being a part of that voice of saying that it was safe to do that. And he quit, and good for him. I hope he finds it in himself to come forward and talk about why he quit and what happened there. Sorry if I'm bouncing a little bit. I'm actually on a ball chair. And so I realize that I do that a lot.
It's all right. I hadn't noticed.
Okay.
So who was it that fired you?
That fired me? It was the Deputy Secretary of DOH, Muriel Roberson, who is not an epidemiologist, but is in charge of the DOH response. She is also the person who asked me to open up the actual data and change the numbers.
Okay, so you were fired. What was the week like after that happened?
Luckily, I had planned on that vacation, so I was not here. My neighbor sent me pictures of, you know, the big vans with the satellites on top and AP reporters peeking in my windows and things like that. My phone didn't work most of that week because I was receiving so many calls at once from every person that it existed that's not Fox News. Interesting, I received 180 media inquiries in that week, and not one was from Fox News. They didn't care to hear what I had to say. But everyone from like Anderson Cooper to Rachel Maddow, print journalists all over the country. And I, like I said, I never wanted to be a part of any story. I didn't answer any of them. I told all of them that I'm not doing interviews. I actually contacted a First Amendment attorney who Roy Gutterman set me up with last year, and asked him, like, you know, what the hell do I do? This is insane. My face is on every single news network in the country. You know, I'm at a bar at a hotel trying to get a pina colada, and which was disgusting. It was the worst pina colada I've ever had in my life. It was gross. And my face was on all 4 of the different news stations at the same time. And a woman spit on me when I was out. And I mean, it was insane. I was so uncomfortable with all of it. They gave me the option to resign in lieu of termination, and they gave me till Thursday at 5 p.m. to do it. And I was weighing that. They offered me a little bit of money as a settlement package, and in exchange, I could never sue the state for anything involving my job. My lawyers said, don't take it. And they're like, your potential claims as a whistleblower and, you know, wrongful termination are too great for, you know, whatever $1,000 they're going to throw at you. And I was actually considering it because I wanted to get another job. And at the last second, interviews that were set up before this happened just canceled on me. And then I watched part of an interview with DeSantis where he went on this insanely violent, almost tirade about me. And he's never met me. We've been in the same room a lot, but he doesn't know who I am. Where he said I wasn't a scientist. He falsely accused me of being under an active investigation of sexual harassment, of all things. and said that I never had access to the raw data. I didn't manage the website, just kind of these crazy lies. And at first I thought it was funny. I was like, okay. I was like, well, anybody who worked on anything involving that dashboard knows that it was me. But then, I started getting harassed a lot after that. And I was supposed to still have time to decide whether or not I was resigning. And that kind of made that choice difficult, kind of ruled out resigning, until I found out that in Florida, all public officials are exempt from defamation lawsuits, period. End of story. They cannot be sued for defamation, which is insane. But yeah, so it was terrifying. It was uncomfortable. I didn't want to talk to anybody about it, but the more it spun out of control, I thought for sure, people would like move on in a day because the news moves pretty quickly. But it didn't. And it continued through Tuesday and through Wednesday and through Thursday and through Friday. And I think that I got to the point where not saying anything was being more hurtful than it was helping. And so I had been speaking actually to Chris Cuomo for several days, just on background about what was happening. And that was mostly because he FaceTimed my mom, who is obsessed with him and in love with him and, watches his show, knows that he had a quarantine haircut and all this other stuff. And so after that, it was kind of like, oh, I guess I'm doing Chris Cuomo. But he was very fair and honest and direct. And that's what I like to think I am. So I appreciated that. And so I did a 4.5 minute interview with Chris Cuomo that Friday night, to try to kind of redirect the attention to where it belonged, which was on, what was going on with DOH data, why that information may not be as trustworthy as before. And it seemed to quiet things down. The governor didn't say anything else about me, other than a UK tabloid publishing pictures of my children and their names and their birth dates in an article. Other than that, it seemed to have died down, which was nice. But yeah, the UK article was disgusting, vile, immoral. My young children, they questioned the paternity of my daughter and posted a picture of her with her name and birth date. And I thought that was kind of the lowest blow that office could try to hit at me. And they've kind of run out of material at this point. I feel like they tried to dig up whatever they could in the first 3 days, and they don't really have anything anymore. But with that article and not being able to find a job, having no money, I didn't make much money as a state employee to begin with. We were worried about, getting paid. And I think I spent a week or two pretty depressed. There was one day in particular that was extremely hard. And I think, I'm going to be honest, I spent the whole day sleeping and crying back and forth, and not knowing if I was ever going to be able to find a job, because the first thing that, came up when you search my name wasn't this amazing dashboard that I built, wasn't all the hard work that I had done with hurricane response. It wasn't my degrees, my advanced degrees, or my resume. It was this tabloid article. And my husband and I kind of got in a fight that day, and we don't fight a lot anymore. But that day we did, and said, basically, like, what did you change? You stood up for this. Okay, great. Wow. You lost your job. Our family has been put into, the world international press. And they're still doing it. They're still messing with the numbers. That dashboard is still up, and it's showing exactly what they wanted it to say. So what did all of this really change? All that it cost us, it wasn't worth it. And that was really hurtful, but also right. Having people think that maybe those numbers are not trustworthy is not actually changing anything about how that information is being shared. And it was a widely trusted resource. I mean, it was written about in international, press. Esri, the developer who uses the software that I use, mentioned it as one of the top 5 coronavirus response dashboards in the world. The other 4 were actually national, like Germany, Lebanon, I forget who the other 2 were, and then mine. And it was something I built entirely by myself that I worked tirelessly on. And it was now being used as a political tool. And that's never what I wanted. And getting fired, being drugged through the press, all of this didn't change anything. So after being depressed for a few weeks and thinking about that, I decided that I was going to find within me, and reaching out to Dean Rubin for help. I might add, reaching out to everybody for help, because it was very scary at one point. We didn't have enough money to pay our bills. Luckily, our landlord was extremely generous and waived our rent for the month. But it was scary. And then I said, you know what? I have all these skills. I'm sitting at home. I'm doing nothing. I can't find a job. My whole issue with all of this to begin with was that people no longer have a trusted resource for information about this. Why not build another one? You know, I did it once. I know how to do it now a lot better than I did before, and I could easily set something up. And so that's what I decided to do. And I knew that doing it would involve more press, which I don't know if you saw my Cuomo interview the first time, but I was extremely nervous. I've never done a news interview before. It wasn't something I was really comfortable with. I was like shaking and like gripping my hands the whole time because I was afraid I was going to make an ass out of myself, which I was, off to do. And I thought, you know what, that's worth it, because things are getting worse. Everything that I tried to warn people about that everyone seemed to have forgotten are happening. Cases from all of the ER and surveillance data that I could get indicated that there would soon be a giant increase in cases, which has happened, higher than any state in the country for today and yesterday, and I think the day before. And so I had to try to mitigate the damage that my original dashboard was causing. And so I built another one. And I made a website around it, which, by the way, I tried to handwrite this and it didn't work. So that's what it is. It's floridacovidaction.com. It has news articles about everything, applications where you can easily find testing locations, which, by the way, you can do in every state in the country, because the volunteer organization that manages it is URISA. They find all the testing locations in the country. So you can use their application for that in New York or South Carolina or anywhere else. And I presented kind of this more get data, get tested, get help approach to it, and made sure to list all the caveats of what DOH's data is saying, and point out inconsistencies in how they're reporting, so that I'm using the same information, but I'm trying to provide context to say, hey, this is what they're reporting, but this is what that actually means, and this is why it may be misleading. I actually now have to go in today and add a note to the hospital ICU bed surveillance, because 2 days ago, the governor announced that they are no longer counting all ICU beds that have people in them as taken, because in his words, they should only be counting people who require an intensive level of care in ICU. And hypothetically, there are people in ICU beds across the state who could be kicked out if somebody with a more severe case needed the bed. And I think that, and this has been widely criticized all over the country, the governor stepping in to change how hospitals count hospital occupancy a week after I make that factor, front and center on my new dashboard. It is unimaginable. Telling your staff to make things look good is a lot different, although wrong, than saying, hey, I want you to count this specifically this way to another state agency. And I have to add a caveat about that data now, because he did that. So it is the number of people that Ron DeSantis, by some undisclosed metric, believes cannot be kicked off if more severe cases appear. All the hospitals in South Miami are reporting that they are at full occupancy. They have 0 ICU beds available, but because of the change in reporting, it looks like they have dozens. So that I'm now going to have to set up another way to get hospital surveillance information than the state agency, because it's not correct. So there's a lot going on, and I've completely forgot the original question. So I don't know if I answered it.
Great. Is your dashboard now effectively competing with the state's dashboard? Has it got traction?
It's gotten millions of views. I don't know if I'll hit 100 million views in 5 weeks, like I did the last time, but it's pulling in a lot. I've gotten so much support. I started a GoFundMe to, help with bills while I work on this, to buy a software subscription, which I had with DOH and then lost. I had to buy an additional hard drive, a new computer, because they confiscated my computer. They came to my house and took my computer. And yeah, so I basically set up a GoFundMe. It's like, hey, I want to work on this thing, and I need to pay my bills at the same time, but I'm going to do it either way. So if you want to help, help. And it went from $5,000 when I went to bed one night to 50 the next day when I woke up. And I honestly, I couldn't believe it. Those of you who know me here know that I grew up with no money, and I am used to having no money. And to actually be able to say, oh my God, I could actually spend a year working on this thing that I care about, that I'm passionate about, and be paid right for it. Because it's basically what I was doing before, just, here without the state influencing what I do on the actual public facing part of it. And it's continued to grow. And if it keeps growing, I'll be able to do this for a long time. I'm still looking for full-time jobs, somewhere to land, because, I can't do this forever. I actually have been working with a couple of states on a proposal to have the plans for how vaccines will be distributed once they're available, to maximize the reduction in cases based on population demographics, historical cases, things like that, which I would really love to do, which maybe could be a part of my dashboard, or I might have to, if it's with a grant, build it somewhere else. But I'm going to keep doing this as long as I can afford to. Surprisingly, the costs have gone up a lot, but through the system that I use. But the support has been amazing. I've had more than 6,000 people actually donate, and that's not including all the physical checks that I've received. And I didn't think anybody would care if I did something like this on my own. And to see that many people do, and they feel like they need that information, is both amazing and awesome that they support me, and at the same time, very scary that so many people know that the state is not trustworthy, and they need somebody else to help them understand what they're saying.
So you're okay then financially for at least the next year because of the GoFundMe account?
Well, one of the problems is that the software the online software I use consumes what are called credits. So every time, somebody wants to look up directions to a testing site or anything like that, it's basically you buy credits, like a video game. And those run out quickly. I actually ran out of credits the first day I ran the dashboard, and it just went offline and was like, this account has been suspended due to non-funds. Like, when you go to the grocery store and your account's overdrawn and they tell you can't use it, which I don't know if any of y'all know, but it happens to me all the time, every other week. But yeah, so I have to keep buying those. But yeah, I mean, that's the major expense at this point. I've applied for basically a nonprofit, free credit kind of thing. So once I get down to below a certain level now, they'll contact me before they suspend my account so I can add more. But I've just been buying thousands of dollars, just keeping it up so that it doesn't go down again. And yeah, I think I have no idea how much Florida is going to take of it yet, but I have officially designated myself as a nonprofit in order to do that. But yeah, as long as people keep helping, I can afford to do it and not, lose my house or have to, move somewhere. I would say move in with my parents, but they don't have a house. So yeah.
Are you going to file the whistleblower suit?
I hope I'm allowed to say this. But
if you can't, don't answer it.
Well, I've spoken to my lawyer and another lawyer, and in the next few weeks, we'll be filing that and others.
Ah, All right, so we have that to look forward to, or I should say the state of Florida has that to look forward to.
Hopefully. I actually asked, I was like, well, can we get a public apology out of this? And they just both laughed at me at the exact same time and said, no, they're not going to apologize to anybody publicly. That's never happened. It's never going to happen. I was like, well, can we make it so that, because I'm not interested in money, that they appoint kind of like a data reviewer or oversight person who's external and not affiliated with the DeSantis administration to survey, how accurately they're reporting data. And they just, again, like in sync with each other, kind of laughed and were like, no. I was like, so I can't change anything this way, but at least it will give, I think, encouragement to other people in the department who have yet to leave, who I know are thinking about it, to do the same.
Okay, I have some questions that have come in from our viewers out there. Rebekah, let me ask a couple of them to you and maybe answer them pretty quickly. We'll get through some. One question, have you been asked to appear and testify by either the Florida Legislature or any other investigative body?
Not sure if I can talk about that. I have been in contact with someone who's, well, she said that we've contacted, so I think I can say that. Nikki Freed is the Commissioner of Agriculture, which is actually one of the 4 roles on the state board. I've been communicating a lot with her about this problem. She oversees a lot of things. For some reason, the Department of Agriculture in the state is tasked with gun licensing and registration, nonprofit registration, all kinds of things. And she's very adamant about having some kind of legislative review at the state level. Several state senators and representatives have contacted me about it. And I have received requests to speak to 2 House committees. So I don't know if I should specify which ones, but I'm actually going to speak to one of them Friday.
Good for you. Another questioner wants to know whether or not Florida journalists are doing stories comparing your dashboard data and the state's dashboard data.
Most stories that have come out in Florida over the last week compare both. Actually, the Miami Herald, who I've been communicating with for a long time, actually, did a huge expose called The Numbers Game. It was a great piece. I wouldn't be surprised if it's put up for a Pulitzer, kind of going over what's been happening with the data. I provided a lot of data to them for that piece and for other things. And yeah, most of them now will say, the state dashboard shows these numbers and the other dashboard shows these numbers. So.
Here's a question I also had, which is, have you ever considered setting up dashboards for other states? We sure need it here in South Carolina.
I would like to work with people in those states to do that. Part of the reason I felt comfortable doing the dashboard that I have now is because I know that data better than anybody who's not a DOH. I wrote that script. I know how it's aggregated. I know its limitations behind the scenes. And so I feel comfortable saying this number means this in reality. I don't have that kind of knowledge of other states. I don't have any idea what data they have or what they're supplying. I wish I could have a dashboard where you could just have a drop down and it have every state in it, which is possible if people within those states who work on, those numbers want to do it. And I would certainly help as soon as I get time. But there are other alternative sites out there that are tracking information. It may not be as pretty as the way I display it, but I had that Newhouse, design experience to help me with that. But there are groups like the, oh gosh, most of them have COVID in the name. To be honest, Johns Hopkins has done a great job since the beginning. They're the ones who put COVID on my radar in January and prompted me to ask for us to do this in the first place. And I would encourage people to check out those because I know that all those groups were a real pain in my ass when I was leading the data and surveillance at DOH because they were so specific and really viewed the data in depth. I'd be glad to share some of those links afterwards. But there are resources out there that aren't dashboards, but you can still get information that's mostly reliable.
Last question, Rebekah, very quick answer. Might you write a book about this when it's all over?
I've always wanted to write a book. Most of you probably know that. I always thought it'd be one of the like 9 science fiction books I've started and never finished. But I think that there's more that I've learned than is worthy of a news article, that if a publisher wants to reach out to me and write about, abso-fucking-lutely.
All right. Well, listen, thank you very much for coming on. And I want to salute you as a citizen for what you've done. I wish more people had your guts, your courage, your intelligence, and we're really proud of you at the Newhouse School.
Thank you. And I Newhouse has always had my back.
Okay, great. Keep in touch.
I will. Bye, everybody.
And thank you all for watching.